Assalamu alaikum, the communication day. First scenario, you are the neurology registrar. You are reviewing Mr. Omar Khalid, 32 years old male, accountant. He has a history of 9 month progressive weakness of the left hand and muscle twitching in both arms, no sensory symptoms, no bowel or bladder issues. Investigations show so far MRI and spine normal, blood test, thyroid, vitamin B12, autoimmune, screening, creatinine kinase, all are normal. The nerve conduction studies is normal. Electromyogram shows very subtle chronic denervation, but not enough to confirm amyotrophic lateral sclerosis. The consultant believed that this is an early motor neuron disease, amyotrophic lateral sclerosis, based on the history and examination pattern. The consultant asks you to explain the diagnosis to Mr. Omar Khalid. You can start now, Dr. Ayula. Here you go.
Yeah. Hello,
Hello.
my name is Dr. Ayola. I'm one of the doctors here today. Can I confirm I'm speaking with Mr. Homan Khalid, 32 years old?
Yes, hello, ma'am.
All right. Is it okay if I call you Homan?
Yes.
All right, Mr. Homan, thank you for coming to see us today. I understand from your note that you've done some tests previously, and you are here for us to discuss this test. If I'm
Yes.
right? Okay.
Yes.
All right, good. I'm here today to give you an update about this result of that you've done. I mean, of this test that you've done. But before we proceed, Homan, do you want anyone to be in this conversation with you today?
No, doctor, it's fine.
Okay. All right. And do you have any particular expectation today?
To be honest, doctor, I'm just afraid that this might be some brain cancer or some issue like that.
Okay, I'd say. Well, I think it's a good place to start. But before I address that concern of yours, is it all right if I check your understanding of what you know about what is going on, so I will know where to start exactly?
Yes, doctor. So, doctor, recently I have been having some weakness in my left hand, and my muscles were twitching. It has been very annoying, really.
Mm. Oh,
So I went to the hospital and they did for me some blood test and they did some imaging and some tracing for my nerves and some other tests for my muscles as well, but I still don't know what's going on.
oh, Hatsi, oh man, that must have been difficult for you. Okay.
Yes.
Well, yeah, well, to start with, because you said to me that you think that could it be cancer or not? Well, I think I'd like to know that at this point that what you have is not cancer. Okay?
Oh, doctor, that's very good. Thank you, doctor. That's
Oh,
so interesting.
yeah, you're welcome home, man. But however, um, when we have situation like this, when people present with your symptoms, what we normally do is to assess them with asking them some question and also examine them, which I believe has been done for you. Is that right?
Yes, yes, all of that was done.
Yes, we also do some investigation, which will include some scans, some blood tests, which you have done in your case, and all this return to be normal.
So all of the investigations are normal now.
Yes, oh man.
So what's wrong with me, doctor?
Okay. So
Right.
based on the history, the question that we've asked you, and the examination, checking your hands, checking your eyes, your legs that we've done for you, the consultant at this point believe that what you have, I'm sorry, Amanda, is not really a good one.
What's going on, doctor? What do I
Yeah.
have now?
Yeah, what it is what in this what is it, this is what we call it's the consultant believes that you might be having an early motor neuron disease. Have you
What's that, doctor?
have you heard about that before?
No, doctor. I have no idea.
Is it okay if I go ahead to explain this to you today?
Yes, sure, doctor.
Okay, are you sure you can continue this conversation alone, or you want someone to come with you
No,
at
no,
this?
doctor. I want to know what's going on with me.
Okay, all right. So motor neuron disease basically is a condition in which there is a breakdown of communication between the nerves. So normally, I'll just want to draw it for you. And in our cord, there is some nerves that control our movement of our body. Okay, when there is breakdown between the connection of this nerve and the muscles of our body, the body begin the muscle begin to act on its own without connection from these nerves. Okay, and when this
Yeah.
happen, it tends to begin it tends to present with the kind of symptoms that you have, such as weakness, abnormal movement in your hand, which can explain what is going on with you. Do you follow me, Homan?
Yes, doctor, but I still cannot get a full grasp of this. Why are you saying this is not a good one? What's gonna happen, doctor?
Yes, Homan. Yeah, that's a very good question. And this is because this condition is a progressive condition. And what that means is that as it has started, it would sadly continue to get worse.
What do you mean, doctor?
What I mean exactly is that it would this weakness
Yeah.
is likely going to get worsen. Is going to get worsen and to get to a point where pie is you might become floppy. Okay, I mean, I mean, the weakness will become flop. Will get worsen. It will affect your movement, and some persons it can affect their speech. Their ability to carry out their daily activity, even the feeding, and it can go ahead to affect respiration. It's something that is actually progressive. And but Oman, um,
Yes,
do you follow
that's
what I've
horrible,
do you
doctor.
follow what I've been saying?
Yes, doctor, but that's really horrible, doctor. Are you sure that I'm having this condition? How did you make sure? You didn't do. You said the test was normal. How are
Oh,
you saying now that I'm gonna be floppy and I will be able to walk?
well, Homan, that is a very good question, and I appreciate your question. Okay. This condition normal is usually diagnosed with history and examination. There is no particular investigation that will tell us that this is it. And oftentimes is a diagnosis that is made after we've been able to look out for every other things that may cause it, that may cause this kind of weakness that you have. And in your own situation, we've checked all that we can and everything is normal. And your history and examination is in keeping with this. That is why the consultant has made this diagnosis.
Okay, doctor.
Yeah. Do you have any question, Oman?
No, doctor, I'm just really concerned about this.
Yeah, I know it's a hard conversation to have at this time, but I want to reassure you that we would support you as much as is available to do. Okay, like
Mm.
because you're gonna get like I've discussed with you that it's going to get worse, and we won't leave you. We will support you and provide as much support as is available in terms of physiotherapy to your legs if that is required. Okay, we'll help you with your speech, and also sometimes we may support you with feeding. I know, yeah, I know, I know it may be difficult, but we would support you in the journey all through. What do you would you have what do you think about that, Oman?
Doctor, can you treat me? There is any medicine or something that can treat this? I don't want to suffer like that, doctor, really.
Oh, I appreciate your concern, Oman, but this condition there is there's no particular treatment that can take it away, but we will support you. This treatment is basically supporting you to see how much we can do to ensure that we will reduce the possible suffering that may come with this. I'm so sorry, man.
Okay, doctor.
Mm. Do you have any question? Any further question
No,
for me?
no, doctor, that's
Yeah.
it.
Yeah, before you go today, I'll ask the specialist nurses to speak with you in terms of supports that are available. Okay. And I'll also be giving you some written information about this. Okay.
One minute left.
Okay,
And we'll also be seeing you soon in clinic. Like I said, we will discuss you we will discuss you further and then give you further treatment plan. Okay.
okay, doctor.
All right. By the way, I am Oman. Do you smoke cigarettes?
No,
What about alcohol?
no, doctor.
Or
Some socially, it's not
or
like
yeah,
me.
that's quite commendable, Oman, because living healthy at this time is quite important, and I would advise you to keep this up. Okay.
Okay, doctor. Okay.
And if you have any further question, I would advise that you get a diary and write them down so that when next you come into clinic, we'll be able to address all of your concerns.
Okay, okay, doctor.
Okay, thank you for speaking with me today. We will see you at another time.
Okay, doctor. Thank you very much.
Okay.
Thank you.
Okay, Dr. Ayola, perfect. You want to add any other question apart from
Yeah, yeah,
social?
yeah. I would. Other question I want to ask, advice, which really like an advice that when nurse is coming, he should come with his family member, any of his family member. One thing I would love to then question, possibly, I'm not sure. Honestly, that's I'm not quite sure. Maybe
It's okay.
driving,
Yeah, the job.
the job. Yeah, how is affecting his job? Is affecting his job. Yeah. Okay.
Okay, and also you can address the driving. If it will affect the driving, he should inform the DVLA, right?
Okay.
Okay. Perfect. Anyway, Dr. Kutuf will comment, then I will comment.
Okay, so Dr. Ayola, you did perfectly. You addressed most of the important things. But one of the things that you should have checked the the understanding more often, the understanding of the patient, because you tend to give chunk of information without understanding. And the other thing, like Dr. Bassem said, you can ask about the job and the social and the financial support because this is a progressive disease. And the patient might not be able to perform his job and to be financially supported, for example. And can ask if the patient is living with someone who is going to take care of him. Okay, so the social and financial status in such condition is very important. And regarding the disease is very progressive, I am not sure. It's usually in progressive diseases and the diseases that have no cure, and we suspect that there is much progression. We can just hint about the advanced directive and the lasting power of eternity, for example, if he has any if plans for the future, for example. And apart from that, you did great. You explained the disease well. You explained the complications. You explained the management plan, that it will be just palliative care. Okay, that the treatment will be just supportive. Okay, and you also addressed all of the concerns very well. But in such case, we have also to stop driving and to notify the DVLA as long as there is symptoms. And you can also, if there is no symptoms in motor neuron disease, if there is no much symptoms that's affecting the driving, I think the patient might be able to continue driving, but they have to inform the DVLA anyway, and they should be assessed regularly in case they develop some symptoms that they keep them unsafe on the road, for example. But overall, you did a great job, Dr. Ayuela. Perfect.
Yes, thank you, Dr. Kutuf, for your comment. Perfect comment. Uh, I believe she did perfect. Yes, I think some mild point. It's not something to affect the whole mark, but in general, she can pass this station once she speak in this way and explain using the empathetic way. She also asks someone to attend to help him to tolerate the bad news. Is it breaking bad news? Yes, it's one of the breaking bad news. The disease is progressive one, and she did that. She gave the golden silence with the warning shot, and she was supportive all over. She offered the support throughout this journey. It will be very difficult. The patient will progress with weakness all over, including the muscle, the respiration or breathing, speech. All these things should be explained. What she miss only, as we know, any disease counseling, you have to explain about the pathology. Why? Is it familial? Is it something autoimmune? Is it something running in family, as I said, familiar one, or something unknown? What do you think, Dr. Ayola? How you can say the pathophysiology of the disease?
I would say that we don't know why this
Yes, exactly.
it's unknown.
So it's unknown. Some families they have this disease running in familial one, and families also have it as sporadic. But the main reason is unknown till now, and the researches are ongoing to know why this disease is there. The cure, as you said, and Dr. Kutov asked you, no cure, but we are here to support you. There is some medication can help to let you have less or less suffering, and also you have to talk about the breathing machine support if you have any breathing difficulty. What are the medication? What is the medication? Suppose if he will ask you, doctor, do you have any medication can help me? What do you think? Is there any medication?
Yeah, there are some medication that we can give to support this, but these are just to support your symptoms, and that will include if you have any form of spasticity, we could
Okay,
give
what
you
is this medication?
baclofen to help you with the spasticity. And
Any other medication specific?
for in terms of what the breathing.
Not breathe. Yeah, it's related to the breathing.
Okay, and another treat, another medication that we could also give you to support, but it's not going to treat you. It's just going to help to, in terms of prolong some like lifespan to some extent, is called Riluzole
Perfect.
will help
Yes.
you with
No
that.
need to mention the name.
Okay.
No need to mention the name to the patient. But in case he asks you, doctor, what's this medication? What you call it? Here you can mention the medication. Plus, the BiPAP or the invasive, the machine can help you to take a breath. Okay.
Yeah, the machine.
So the pathophysiology and the mechanism why why the disease there, what happened exactly. Okay, I mean the reason or the underlying cause and the pathophysiology. What happened exactly? You said there is disconnection between the nerves and the muscles, right? And the other thing, the complication, you mentioned it. It might affect your breathing, swallowing, movement, and you have to mention the type. Since it was written in the scenario, use it as a word while explaining the type. So you have motor neuron disease. Let me explain about the disease. I'm so sorry to say. It's one of the progressive disease. And you have the type called amyotrophic lateral sclerosis. Why they mention this type? Because this one of the progressive course or the progressive type. Okay. Amyotrophic lateral sclerosis affecting the muscle as well as the bulbar, right? So you have to mention the type since it was written there. Next, the complication we finish. The support, the cure, no cure. The management will be supportive only to help you not to have any suffering in the future in the form of occupational therapist. They can provide you with the tools, will help you how to cope with your daily activity, wheelchair, stick, whatever he will suffer, they can provide him. Don't worry, Mr. Omar. We will be here to support you throughout this whole journey. The social support, once you hear 2 minutes left, ask for concern. No concern, you can ask with whom you're living. It's very important to ask. Why? Because he has family who are dependent on him. So what to do? You have to offer support for the family that who need support as he was or as he is the one taking care of this family. Now he will be, maybe he will be sitting at home and they will need support. Okay. Do you smoke? Do you drink alcohol? I can see from the scenario that you are accountant, how that affecting your job nowadays. No, doctor, still, I have some weakness, but I can still do my job. If he said, no, doctor, I cannot do my job, so we can refer you to the occupational worker to reallocate you to easier job, or if he cannot do anything, we will give you sick leave and we will contact your company to provide you fitness paper. And the last thing, do you drive? Yes, I drive my own car. Is it affected? No, doctor, it's fine. If not, you can say, please inform your DVLA. Whenever you have anything can affect your driving, we are worried about your safety. Please inform the DVLA. And thank him again. The advanced directive, Dr. Kutov mentioned, but I prefer not to speak about it in the first meeting with the patient unless he knows the diagnosis. If he knows the disease, you can speak. If not, if you have time at the end, you can tell him, please think about your future management plan, how you want to be treated, and what offer you want us to give to you through this journey. So he can choose some of the options. He will tell you, no, doctor, I don't want to put into tube inside my throat. I want to be treated fully as I am okay, whatever. But this is not the time because he just have a shock from the diagnosis today in the meeting. Okay, Dr. Gutov? So if you have time, you can ask it
Okay,
in
doctor.
this way. Yeah. If you are planning, if you are thinking about how to be managed, please let us know. Think about it with your family. Why, doctor, do you think it's progressive or I will die soon? You can tell him, unfortunately, the disease is progressive one and we don't know what will happen with you. We are trying to do our best to support you, but we don't know what will happen exactly. So please think about your management plan, how you would like to be managed in the future. So you are showing the example that you are talking about advanced directive, but not as a wish, because this patient never ever thought he has something can disable him. He just said, I am fine till a couple of days. I did this investigation and everything is not as he is expecting, right?
Yes, we can just hint about it.
Yes, by this way. So don't tell
Yes,
him, you have any advance directive? He'll tell you, what do you mean, doctor? I'm fine.
yes,
I don't think there is something can
yes,
affect
that's
my
right.
life. But now he should think about it because it's something can compromise his life. Okay?
Yes, doctor.
Okay. Thank you, Dr. Gutov. A
Thank
nice scenario,
you.
by the way. And Dr. Ayula performance is perfect. I will
Yes,
send
it
you
was
your
very good.
scenario. Yeah, I believe she did perfect. Okay, Dr. Gutov now will be the candidate, your scenario, Dr. Gutov.
Okay.
I will, yes, in the chat box now. Give me a second. Okay, here you go. You are the doctor in the metabolic obesity clinic.
Okay.
A 38 years old man with body mass index 40, type 2 diabetes, is attending to discuss weight loss surgery. He was
Mm,
previously on metformin but stopped due to diarrhea. He wants to know more about surgery option and whether he is a suitable a candidate for the surgery. Your task is to discuss bariatric options surgery, address the patient's concerns and expectation. It's good and new trending scenario. Thank you, Dr. Ayula, for offering this scenario.
okay, doctor.
Okay, prepare yourself for 2 minutes or more. If you want 3 minutes, then we will start. I will have good open discussion now with others. Anyone has comment, please?
Mm,
Anyone want to comment or to add any point missed from us? Okay, Dr. Railozor, yes. Dr. Ihtisham mentioned it. Dr. Tahani, Dr. Ahad. Okay. Anyone want to comment about the motor neuron disease? If no one, I will ask about the types of motor neuron disease. Anyone has idea? What are the types of motor neuron disease?
Um, Progressive
Yes.
muscular atrophy, this is the pure lower motor and has the best prognosis. There's also beside the amyotrophic lateral sclerosis, there's the primary lateral sclerosis, which has a pure upper motor neuron, and the progressive bulbar palsy, which is the one with mainly bulbar and carries the worst prognosis.
Perfect. Yes.
Mm.
So, what team you have to involve for the bulbar symptoms or for the
Um,
bulbar type? What
it's,
we
it's
call
the
this? Yeah.
That's the SOL team, yeah.
Soul team, yes. Speech and language therapies. Right. Perfect, Dr. Omar. So you mentioned the four types we know or
Mhm.
common. There is, I think, more types, but these are the most
MND
common
cells.
ones. Yes. And amyotrophic lateral sclerosis is one of the mixed type, right?
Yeah.
Upper in the legs and lower in the hands.
Mhm.
They are calling it as upper and lower, lower and upper. Okay.
Yes.
Any point you want to add regarding this performance?
No. She has done so well.
Yes.
Yeah, she has done so well.
Yes, perfect. Any question, Dr. Omar? Or
No, thank you.
comments? Okay. Anyone
Thank you.
has comment from others? Thank you, Dr. Omar, again. Okay. Dr. Camp, primary lateral sclerosis, upper motor. Dr. Kani, amyotrophic lateral mixed, primary lateral sclerosis, upper progressive spinal atrophy, lower progressive bulbar atrophy, lower. Okay. But you have to know the amyotrophic is the mixed type. The primary lateral is upper. Progressive spinal is atrophy is lower. Progressive bulbar atrophy is lower. Okay. So you have two lateral and you have two progressive. I mnemonic them like this. I can remember them by this mnemonic. So we have two lateral, amyotrophic and primary lateral. We have two progressive spinal atrophy and progressive bulbar palsy. It's not atrophy, it's palsy mainly, progressive bulbar palsy. So if anyone has or other idea how to recall them, yeah, palsy. It's okay, Dr. Kenny. I think this is the best.
Dr. Basim, I just wanted to ask you how to explain this diagnosis of motor neuron disease to the patient in his own words. So, how
Yeah.
will you explain the diagnosis?
So as I said, it's unknown disease till now, and the researchers are going to know what exactly the cause of this disease. Sometimes it runs in family. He might tell you, yes, I have this disease in my father and my mother. So finish this part. What are the mechanism or how the mechanism or why this happen? There is a problem between the nerve cables and muscle. So the nerve cables cannot give the order to the muscle properly. That's it. No need to be more complicated. The patient will be more confused.
Confused. Yeah.
Exactly. Simply, it's motor disease, motor neuron disease. So it's related to the muscle and the nerve supplying its muscle. That's it.
So, basically, if we just say that it is a kind of a disconnection between the nerve and the muscle, due to which the signals are not being properly conducted, and that's
Yes,
why the
exactly. In
muscle,
this way.
that should be okay.
Yeah, that's enough and fair enough.
All right.
And the most important, and I think Dr. Ayula also answered it. Doctor, any cure for it? No cure, as up to date, no cure from this disease. The other thing also about, so yes, the cure. One more point I wanted to add: the cure, the management, and the progression of the disease, the muscle affected, the group of the muscle. Yeah, I think this is what I wanted to say. But be simple as much as you can. Don't be complicated in the explanation. Okay, he will not understand you, and you will waste time explaining a lot of information which is not necessarily be delivered. Okay.
All right. And regarding one question, because the patient asked, is there any medicines?
Mhm.
Because the patient didn't ask if there's any medicine to cure. So she just asked that whether there is any medicine. So in that case, we can mention riluzole because there
Yeah,
is kind of some
there is.
benefit. Obviously, it's not a curative treatment, but it
Yeah,
is something which have been used in motor neuron ALS. So we can mention that it can help somewhat, but the disease generally
symptoms.
it is something which is going to progress irrespective of the treatment, but we can mention that as a treatment, isn't it?
Yes, exactly. So you can say there is a medicine that can help to regress the symptoms, but it will not cure the disease.
Right, yeah.
Okay, but the best here is the machine for breathing because the patient will suffer sooner or later of the breathing difficulty. So you can tell her or him, unfortunately, even it can worsen and it can affect the breathing, your ability to breathe. In that time, we can connect you to machine and you can breathe through a mask on your face to help you breathing while you are sleepy or even at the daytime.
Right. And do we need to ask and about smoking and alcohol? Because I
Yes,
mean,
yes.
smoking is something which is generally associated.
Yeah, yeah.
Some of the studies have shown, obviously, that there could be an increased progression of the disease if you continue to smoke. So do we need to ask about that as
Yes,
well?
yes, sure. Any disease or any health condition you have the patient newly diagnosed, the smoking will affect it more and more.
Yeah.
So you have to raise this issue and to ask about it for how long and so on, as we do with every scenario.
Right. Right. Okay.
Okay.
Thank you.
Okay.
Thank you.
Thank you, Dr. Hacham. Thank you, Dr. Oktov. I think you're ready now.
Yes, I'm ready.
Okay. Here you go.
Okay. Hello, my name is Dr. Abdussalam. I'm one of the doctors in the obesity clinic today. Can you provide me with your name, please?
Dr.
Hello.
Ayula, you are there.
Okay. Yeah, I'm Charles Clay, sorry. I'm 38 years. We can call me Charles.
Okay, let's start over. Hello, my name is Dr. Abdussalam. I'm one of the doctors in the obesity clinic today. May I confirm that you're Mr. Charles?
Yes, that's me.
Okay, nice to meet you. Okay, I'm here today to discuss with you some issues about your health. Is that okay with you?
Yes, sure.
Do you want us to wait for anyone else to attend with you this meeting?
No, doctor, I'm fine.
Okay, that's great. So I understand that you have been troubled with your weight and with your diabetes. So can you
Oh,
tell me more about that?
oh yes, doctor. I have been having concern with about my weight. I've added a lot in the past couple of years, and also recently, my doctor told me I had diabetes. I've tried medications, but it's not just sitting right with me. I have to, lose motion over the time, and I have to stop it. I'm just tired. And I've read about that I can do surgery to help with my weight. That is why I'm here today. So I wonder if that would be an option in my case.
Okay, so Mr. Charles, I understand where you're coming from. So in your case, you already tried the one medication. It's very common for this medication to use this side effect. Yes, but for such cases, your condition is directly related to your weight. So in such cases, we prefer to start with lifestyle changes first. For example, like exercise and certain diet to lose your weight. Have you ever tried such thing?
Oh, I've done a lot. Exercise, even diet, but it seems not to be working for me.
Okay, do you have any idea why it was not working?
I don't know.
No problem. We will try our best for now. We can refer you to a dietitian to give you the suitable diet for your condition. So it will be more helpful for you. That's fine by you?
Yeah, it sounds like a plan.
Yes. And what about exercise? How often do you exercise?
Well, I try to walk around about 30 minutes every day. So I walk about 30 minutes 7 times a week.
Okay, 30 minutes every time. So there is any barriers to this, or can you keep up with this?
It's just my knee. I feel a lot of pain in my knee. So I find it difficult sometimes to keep up.
Okay, I'm really sorry for that. It's very common actually to have such knee problems, given your condition. So in this manner, I can refer you to a physiotherapist. They will give you special exercises that can help with your weight reduction, but in the same time, it will not affect your knee. It will not cause knee pain, because I understand that walking can be really challenging in your condition.
Okay, doctor, thank you.
Okay, that's fine by you?
Yeah.
Okay, that's great. And so, other than the diet and the exercise, I just want to know, do you consume alcohol?
Oh, no, no.
Okay, that's great because alcohol as well, especially beer, can also increase your weight. So that's very good that you're not consuming it. So, do you smoke?
No, doctor, I don't.
Yes, that's very good. So, as we are saying, one of the options in your condition will be lifestyle changes. So I believe that many patients have many benefits from the lifestyle changes, especially when guided by experts like dietitians and like physiotherapists. And other than lifestyle changes, there is also different medications we can use first before we go to the surgery, because usually, we put surgery as a last resort. So there is other medications you can try as well, some tablets and some injections.
Oh, I never know.
Yeah, there is other options. So this is an option as well. So in your case, we will try with the lifestyle changes. Then we can go to the medication as well. We can try different medications since that medication wasn't suitable for you. How are you feeling so far?
Okay, could be, yeah. It's something we could explore.
Yeah, that's great. So regarding the surgery, I will explain to you a bit about the surgery and why we are keeping it as a last resort. So bariatric surgery is basically the most common one is cutting a part of your stomach, so it will not take much food. So the first thing about it, that it has many risks that we want to avoid and many complications. Are you following me so far?
Oh, yes, doctor.
Yes. One of the risks of this operation is the risk of any surgery, that anesthesia risk, and the risk from bleeding and infection after the surgery, for example. And specifically for this condition, it's irreversible, so you cannot go back from there. And
Okay.
yes, and it carries a long-term risk because you have to take many vitamins for life, and you might have different complications for that. You can have some vitamin deficiencies, you can have anemia, for example, or iron deficiency. That's why it carry a lifelong risk. That clear so far?
All right, that's it. I see why my GP asked me to come see you exactly. But doctor, do you think it's going to help with my diabetes?
Yes, that's the surgery can help with your diabetes by indirectly by reducing your weight. So in your case, this is type 2 diabetes. So this type diabetes is directly related to your weight. So if you lost your weight by exercise, for example, by lifestyle, or even by surgery, it's going to affect your diabetes in a positive way. So it's going to control it more.
Okay.
So the key point is the weight loss.
Okay. And do you think that this will cure it will cure this a bit? I wouldn't gain weight anymore once I have the surgery.
No, that's not guaranteed actually. You are going to start losing weight after the surgery, but you need to keep up with this in the future, to keep up with the exercises. Even after the surgery, you have to keep up with exercises and with certain diet as well.
All right.
It's not
Okay.
very guaranteed, yes.
All right, that's it. Thank you, doctor.
You're welcome. Is this clear so far?
Yeah.
Do you have any question about what we just said?
No.
Okay, that's great. Do you have any more concerns?
No, I'm good.
Okay, that's great. So we are just discussing the options of the weight loss, the lifestyle changes, and the medication and the surgery as well. The one of the benefits of the surgery that we can go for it if we failed with the other measures. So it will be a solution in that case. So this is the benefit of surgery. But in such case, we don't rush for surgery usually. If you're getting what I'm coming from. Okay, that's great. So can I?
Doctor, do you think I'm qualified for this surgery? Do you think I can have this surgery? Because my doctor have told me about it, that there are reasons why this surgery are done.
Yeah, usually in your case, because you have a disease, that condition, which is diabetes, that's directly affected by your weight, and your BMI, which is something related to your weight, is more than 40. So you are a candidate. You can go for this surgery, but as we discussed, we need to go first for other measures because the surgery has its own complications.
Okay, all right, thank you.
Okay, is that clear so far?
Yes, it is, doctor.
Okay, that's great. So I just want to ask you a few more questions. What do you do for a living?
No, I'm a teacher.
You're a teacher. Do you do sedentary job? You're sitting in desk all day, or what's your job?
Normally I should stand, but because I feel a lot of pain and my weight troubles me, I oftentimes sit to work.
I'm really sorry for that. And regarding your knee, I can refer you to the joint doctor with a bone doctor by the end of this session, and he can look more into this knee problem, and we can help you with it.
Okay, thank you.
Okay,
That's
great. So, what's regarding your financial status? Are you financially supported?
Everything is fine.
Yes, that's great. So, with whom you are living?
Oh, I live with my partner.
Okay, that's great. And how is this affecting your life, this condition?
No, it's just, yeah, it's okay. Nothing really, nothing major. Just my work that I can't do exercise and I can't stand up to work at work, basically.
Oh, I'm really sorry for that. So, can you please recap for me what we just discussed?
Yeah, you've seen me a lot of information that I need to exercise, eat all right. Then I'm qualified for the surgery, and there are some benefits and risks that are associated with the surgery.
Okay, that's great. That's really what we just said. So for now, I can give you some brochures and reliable websites to read more about your condition, your diabetes, to read more about bariatric surgeries and other weight loss options. Is that okay with you?
Yeah, it's fine, thank you.
Yes, that's great. Thank you very much for you, Mr. Charles.
You're welcome.
Okay, 15, 14, 13. Any other point you want to address? However, you did perfect.
Thank you. I cannot recall anything.
Okay, I think the time is up. Dr. Ayula, you can comment, then I will comment.
Well done. You did well. You answered a lot of questions. I mean, you gave me a lot of information today, which I believe are all relevant information. Of course, you follow the guidelines that patients should try lifestyle changes and before you consider surgery. But I don't think before you consider surgery, and you mentioned the indication for surgery, which you mentioned late, but you also you mentioned it eventually when I asked. And my first question I asked was, doctor, do you think it's something that can be considered in my case? But you left it for to the latter hand to is one of my concern, and that was one of the things that is one of your tasks in this question, in this scenario. But every other thing you did was good. You had addressed the lifestyle, you addressed the medication. Other things I think we should that could be important is the bariatric surgery. That's the main meat of this conversation. And the patient, just say like the way we used to talk about the procedure before this procedure, you will be assessed, and they will look out for everything that may cause a risk in your case. We'll address it before the procedure to see if you are suitable for this procedure. We'll also counsel you. We'll also send you for psychological support, because this procedure is a life-changing thing, and you need to be convinced about your decision, and also for support as well. During the procedure, who we do it will be done by an expert, the surgeons, okay? And it's generally a safe procedure. Just let the patient know, and after the procedure, we'll monitor you closely, and the complication which you mentioned, which you said brilliantly. And you also emphasize on the fact that it's not a cure, it's just a tool to help achieve the weight loss. So we need you need to cooperate with us to achieve this by continuing to exercise even after the procedure. Then follow up is actually important in this patient as well. We'll continue to follow you up even while you've had this. And you mentioned the nutrition part of it and the vitamin loss, which are all good complication which you mentioned. The other thing I think maybe you should have added is the fact that you would refer the patient to the surgeons, because you're not the one that would do it, so you just want to refer them to her, because there are various options, there are various types, which I knew you were going into before I came in. Before I started asking my concern, there are various options of various type of bariatric surgery. So we will refer you to the specialist who will have a further conversation about it, except you are confident in discussing the different type of bariatric surgery. We will refer to the specialist who would discuss different options with you, the risks and benefits of each of the option, and you will make your decision accordingly to the one that you think is suitable for you. We will support you in whatever the decision that you make. So I think altogether it was a good station. Well done. The lifestyle, the medication, and the surgery. Thank you.
Thank you, doctor. Yeah, I think I should have discussed more about the surgery itself, because
Yes.
this is the main aim of this station. Okay,
Yes.
that's a good comment. Thank you very, doctor. Thank you very much.
Thank you too.
Yeah, thank you, Dr. Ayula and Dr. Gutov. Well done. So, as I said to Dr. Ayula, it's a good performance. You can pass station, even if the minus 2 or 3 marks, just for the clinical judgment. Why I will minus you in the clinical judgment, Dr. Gutov? What do you think? Is it indicated for surgery? Is it advisable or not?
This patient, I think it's not my decision. I think I have to refer him for
Okay.
the bariatric
Yeah,
surgeon.
that's why I'm saying this is clinical judgment point.
I was saying it, and at the same time, I was thinking that this is not my job.
Yes, you're right. You can refer and they can decide, but you use the way of confronting. You use the disadvantage of the surgery only. So you give her the all or give him the all complication, and I think he will be worried and afraid of this surgery, and he will be more accepting to do the exercise and lifestyle medication. But however, the body mass index written there, how much?
40.
40. Do you know that the 40 body mass index, even without health problem or health disease or health affection issue, he is candidate for surgery? Or this is the first indication. So 40 or a higher, this is an indication for bariatric surgery. The other point or the other indication, whenever type 2 patient, type 2 diabetes with body mass index more than 35, this
Mm,
is another indication. So two indication, either 40 and higher or 35 body mass index with health disease or health condition such type 2 diabetes. These
okay.
are the indication. And he has 40 and diabetes. So he's more indicated for surgery. I felt from your talking that you don't want to give him the option of surgery. He want to know. This is also can help you because it's not advisable by consultant. He is the one asking you. And you give him the options, lifestyle modification, the alcohol, smoking, the diet, exercise, and so on. But here, if the advice is to talk about it and to convince the patient, don't use the way of confronting like there is a lot of side effects. Yes, you have to talk about side effect, but don't tell him like everything will happen as negative or it will affect or harm you.
Yeah,
This,
understand.
right?
Yes, that's right.
Yeah, you try to convince about the other way. But this patient is one of the indicated persons or patient to have this surgery. So I believe he can have this surgery. It will help him in the future. Even it will control his blood sugar. Let's
Mm,
talk about the options. You can ask him what option you know. What the option you know about the surgery? As Dr. Ayula said, you talk about one way, which is gastric sleeve, right, or sleeve gastrectomy. But
yes.
there is two option: Row and Y, gastric
Mm,
bypass, and the third one is gastric banding laparoscopic. Okay. So these
mm,
are the three options, either laparoscopic gastric banding or gastric or sleeve gastrectomy. And the third is Row and Y with bypass, gastric bypass surgery, which is a more advanced one. He will,
mm,
if you can ask him, what do you know? He will tell you the types if he knows. Of course, he will read about them and he will tell you, yes, I have read about such types. What do you think the best for me? Now you can refer him to the bariatric team to discuss which is suitable for him.
okay.
What are the complication? Yes, the complication might happen more with a certain type and other will be less. The less invasive will have less side effect. But you have to talk about, as we mentioned always, any procedure and surgery having two P's, two eyes, two P's, perforation pain, and you can add bleeding, of course. Here you can also talk about infection as a post-surgery infection and injury. It's very common side effect to happen after surgery, the injury to the nearby organs, esophagus, esophagitis or esophageal tear. You can talk about gastric perforation or bowel perforation or liver injury or whatever will happen. So you can give him a hint about the most common complication during the surgery. You mentioned complication related to the anesthesia. What is anesthesia? Is it jargon?
Yes, I think it's a jargon.
Yeah. So what you can choose as a word? Okay. So there is a team. We will give you numbing
A
agent.
numbing agent, yes.
Yeah. These numbing agent might have side effects. Okay, we can also refer you to that this team or this team to sit with them to address it. So the anesthesia, pre or before, during, we mentioned during, after, the one or the ones you mentioned. What are the most common complication after surgery? Malabsorption, vitamin deficiencies, anemias, even regaining the weight again. Okay, all of them as a complication or most common complication post surgery. You have to keep doing exercise after the surgery and so on. I read about the comment of consent. Yes, you can mention it as one of the important thing before the surgery. You don't know he will go or not, he will accept or not, but you can ask him like initial opinion. What do you think about it now? Are you still in favor to do this surgery or you want to go with the a lifestyle modification? Okay, then he will tell you, yes, I will go to the surgery. Be sure there is a consent form, you have to sign it. This is regarding the comment of consent. The other comments about Ozempic, the medication which can help to reduce the weight and control the blood sugar. If the scenario is open discussion about what are the options to control the weight, you can talk about it. But here it was clear, straightforward, the task about bariatric surgery. But he might ask, or the patient might ask you, doctor, what do you think about this medicine which is given under the skin, which can help the reduction of the weight? You can speak about it, but I don't think it will be raised by you unless it was written there. The task here is clear for the bariatric surgery. And this is not the scenario actually. The scenario is supposed to be advised or not advisable. Okay, patient is indicated or no. Here they give you the scenario like talk about it. So you will ask like discussion between you, a conversation between you and the patient, as Dr. Gutov said, but not to be in favor of not to do the surgery. Okay, don't use this way. You are here to be as a neutral. There is advantage, yes, as you want to lose the weight, but there is also some disadvantage. The advantage or the as we know the cons and pros or pros and cons. What are the advantage here? You can lose the weight, you can control your diabetes easily, and of course some of the disease will not have in the future related to the obesity like the knee affection, the osteoarthritis, and so on. These are the advantage. What are the advantage? Now you can talk. But I felt from Dr. Gutov, she's talking about only the complication, which is the way is pushing the patient not to accept this surgery. I think this is what we are doing in our real and practice in the life. Anyone asking you as a relative, do you think the bariatric is okay for me? You will tell him no, it's a lot of complication happen with it. This is the real, right, Dr. Kutuf? But this is not in the
Yes,
page.
yes, doctor. Honestly, I feel like I was doing this scenario, didn't digest the scenario well. I treated this scenario as not
Yeah,
to advise the patient against
exactly.
this bariatric surgery, but I should have treated it like explanation of any
Exactly.
procedure, like any procedure, for example.
Exactly. Yes.
Yeah, yeah,
Perfect. So this is only a comment. Be neutral. Talk
yeah,
about the
right.
cons and the pros equally, and the patient will choose. Not only that, the patient is indicated for surgery. Maybe he will fail all this lifestyle notification, and he came now after he gave up. I cannot do anything more. I want to go with the surgery. You cannot tell him no, don't go, or you can tell him to force him not to go now. You cannot do this surgery. No, this is not your right. Even you are talking, but don't confront him. Give him the advantage and disadvantage. At the end, tell him, what do you think? Are you okay to go or you are not? This is the way how to deal with any procedure, not only this. So you consider it as a procedure or
Yeah.
surgery. You give, as I said, the advantage and disadvantage and let the patient decide after that. Okay?
Yes, doctor.
Yeah, thank you, Dr. Kutov. Otherwise, you did it perfect. You know how to communicate. I think, yes, it was perfect
Thank you.
performance. Okay, thank you, Dr. Kutov. I will go to the comment quickly before opening the discussion. Yes, the consent, I already commented on the consent. If he's agreed verbally, so you'll tell him there is a consent form. Dr. Tahani. Dr. Kani, can we talk about Ozempic in this situation? As I said, if it was mentioned, you can raise it. If not, not the time to talk about it. Otherwise, if you will talk about it, it will take time from something else you have to talk, like social support, like smoking, alcohol. Okay, the task here is about bariatric. Unless this the surrogate asks you, doctor, if there an option can be given instead of surgery, you can talk. But this is a task of bariatric surgery. Dr. Tahani, you need to discuss the benefit and complication of surgery exactly, not only the complication, both you have to talk about. Dr. Kani, body mass index more than 35 plus diabetes, obstructive apnea, hypertension. Yes, any disease, not only diabetes type 2. If there is any disease plus body mass index more than 35, this is an indication, or body mass index of 40 and higher, another clear indication for sin. Yeah, Dr. Tahani, the option gastric bypass, gastric sleeve, gastric bandage. Perfect. Simply, she mentioned them: gastric bypass, gastric sleeve, gastric bandage. Just two words, no need to mention more than this. But I wanted you to know what the name of the surgery. But if you mention like this to the patient, it's fair enough. We should tell even after surgery, lifestyle modification, very important, should stick to it so not to fail exactly. You have to take also some vitamins to be compliant to the medication and not to eat more. Otherwise, you will again gain the size of the stomach and you might regain your weight again. Do we need to ask all these questions in social? What are questions? Social include with whom you're living. Do you smoke? Do you drink alcohol? With whom? What's your job? If the driving affected, you can ask about driving. Not more than this. Okay? With whom you're living? Do you smoke? Do you drink alcohol? What's your job? What's the impact on your job? And if there is driving issue, you can address the driving. Only these questions in the social, I mean.
I mean, doctor, she already asked about did you exercise? Did you what about your diet? Yeah, all these questions need
No,
to be
it's
asked here in
related.
this.
Yes, in this scenario, you are talking about lifestyle modification, the diet and
Yes.
exercise. Okay.
Okay.
Yes,
So
you
we
can
can
talk about. Yes,
ask,
yes, but
or we can just offer, like,
not not as a question. You can instruct. Okay,
yes.
you are not asking as
Okay.
history taking. How's your diet? How's your So the best way is to give him advice. There is certain methods before going to the surgery. What are they, doctor? The exercise. So you can run or walk for 30 minutes every day for the 5 days per week. And the diet, if you are not controlling well, we can refer you to the dietitian. They can help you. He will tell you, yes, doctor, I need some help from the dietitian. Yes, doctor, I have to do some exercise. Or he will tell you, doctor, I give up with these ways. I want to go to the surgery. Okay, so don't ask him about these things as a question. It will consider as history taking. However, it can be as indirect relation to the questions as in communication scenario. I mean, you can ask because it's indirectly related to the diabetes or the disease itself or the condition in general. So they will not consider it like a direct question of the history taking. But I believe and prefer always to do these things as instructions, not as questions. Okay. Start by instruction. from the start. You have to do 1, 2, 3. If you fail, we can refer you to the dietitian. If failed, we can consider the surgery. However, in our scenario today, patient is indicated to do the surgery because, as I mentioned, the body mass index and the diabetes as well. Clear? Okay. Anyone want to add any comment? Yes, Dr. Omar.
Um,
Yes. It's one of the trending scenario, by the way, Dr. Omar. Yeah, nowadays they are talking about, I think every diet they are trying to create a new scenario. This bariatric surgery, one of the newly appeared scenarios. Okay, someone was talking. Sorry to interrupt, Dr. Ahad, right? Continue, Dr. Ahad.
yeah, I just would like to emphasize on the importance of the aim
Yeah.
of the scenario, because I think if I'm first of all, she did well. She's just explaining things in very nice way. But if I'm just doing this scenario, I will just like spend very short time in explaining the lifestyle modification.
Yes.
Maybe
Yes.
just brief touching like in 1 minute, because I've just observed like she spent more than four
Yes.
minutes explaining the lifestyle modification, which is not the aim of this scenario. So as I mentioned, that I will very briefly touch upon the lifestyle modification, just to emphasize on the importance of sticking to lifestyle modification, even in the occurrence of the bariatric surgery. But the main aim of this scenario is explaining the bariatric surgery itself. So as Dr. Pasim said, types of the bariatric surgery, and like before, like also brief discussion about the assessment or pre-assessment before the surgery, and then the bariatric surgery itself, the benefit of the bariatric surgery in general, and if there is a specific benefit for some of them, you can also mention, um, like excessive weight loss, hypoglycemia, maybe anemia, and the risk of the surgery, because I've just noticed, as Dr. Batten said, that you are defending the lifestyle modification, and you're just mentioning the risk of the surgery. So I think more time spending on the surgery itself, explaining more about them, just brief, very brief, touching on the lifestyle modification, just to emphasize on the importance of sticking to them. Um, yeah, I think
Yes.
that's it.
Perfect, Dr. Ahad. Thank you, Dr. Ahad. I agree with your comment. Also, I read this comment from Dr. Kani. A good scenario, I would have tried to decide here from the surgery. This is in real, but not in cases. Whenever you are sitting to a patient, you have to be as neutral, not to decide on behalf of him. He's here to know everything and let him decide. Okay? So don't push or don't be in favor to do this thing or in favor not to do it. Unless it was decided by your consultant to push him, for example, to do. So you have to convince. If the consultant decision is not to do, you have to convince in the other way. But if he asks for opinion, so you can give the all things related to the surgery and let him decide. Not only the surgery, any procedure even. Okay. Be honest while discussing these things and let him decide after all the pros and cons.
And just one point, Dr.
Yeah.
Basim, regarding the question of am I be eligible for the surgery itself? I think if I were the candidate, I will just mention that according to the BMI, so
Yeah.
she's been having BMI of 40 and also diabetes
Yeah.
mellitus. So if I were the candidate, I would just like mention that according to her BMI, this is an indication itself for the bariatric surgery, but
Yeah.
this is also is not my decision at this point.
Exactly.
But in general, I will just give the good I mean the correct information at that time, and then
Mhm.
I will just leave the decision for the pediatric surgery team.
Exactly. Yes, exactly. Why we can give the decision for or postpone the decision to the bariatric team? Because you don't know, after you convince her, she will go there and the surgery will say, oh, I cannot do this surgery for any reason, anesthesia related or surgery related. So for the final decision, yes, to the patient, is the patient right to decide, but again, it will be shared decision with the surgery, the person who will do the procedure or the surgery, not you. Okay. Yes, medically, patient is indicated, but you don't know what exactly will happen with the surgery team. Okay, the most important, Dr. had comment mentioned the hypoglycemia. Most of those patients will go in hypoglycemia because of the malabsorption. So be careful about this complication. It might happen there, and the patient will feel dizzy with standing from sitting position. Maybe he will have even the hypoglycemia exaggerated. So you have to mention the hypoglycemia later on. Even the need for the insulin might be less than expected. Why? Because he cut part of his stomach and the absorption of the sugar not like before. Okay. Anything else you want to add? Anyone?
Well,
Dr.
so
Omar's
it
very
could
good
be
scenario. Yes.
it
Yes,
could be
doctor.
just the endocrinology referral because of her BMI and diabetes. In the scenario, it wasn't clear if she has been reviewed by endocrinologist yet or not. She might be seen by the diabetic nurse specialist before the endocrinologist.
Yeah. So still, it's not a final decision, as I said. It's multidisciplinary team approach. So group of doctors will share the decision. Not only me as a metabolic or obesity clinic, not only the surgeon. There is also option from diabetic or opinion from diabetic. This is what we are doing. Even anesthesia, they have opinion. Is it risky to proceed on or to postpone or to have an echo? Cardiologist also might share an opinion for the cardiac risk. So it's a multidisciplinary team as we usually do in our life and the paces. It's multidisciplinary team decision. Okay. Yeah, always put it as a group of doctors' decision, not one decision. Even after this discussion with the patient, still this is not the final decision. We have to refer you to the clinic of the surgery or the anesthesia or whatever, just to decide and to share the decision regarding this procedure. Thank you, Dr. Ihda. It's our pleasure.
Sorry.
And it's,
Yeah.
yes,
Yes,
go
please go
ahead.
ahead. Yeah.
Yeah, no, I'm not saying anything else. You can continue,
Okay.
comment.
All right. Okay. I think that, I mean, first of all, obviously, it was a very good scenario, very prevalent, obviously, considering the prevalence of obesity. Now, the thing which everyone appearing in the exam, or generally, if obviously, if you're working in NHS or anywhere, so this is very sensitive topic. So, I mean, whenever you are discussing about someone about obesity, I think that's something. So there has to be a lot of empathy. At one point, I think the candidate here, because when he asked from the patient that what exactly is the impact of that obesity, and I think that surrogate told that there was some knee pain, and the candidate just put it like it is just due to your weight. So it will be considered quite rude, and people, especially in UK, I mean, if you are going to say like this, so they will definitely mind, and the examiner are quite mindful of that thing. So they generally minus in the welfare part that you didn't take it. So it has to be, I mean, you're right in a way, you haven't said anything wrong, but it is quite a sensitive topic when you are discussing
Mm,
about the weight. So you need to show a little bit more empathy in that case. So I
yes.
think that's something which is important in any such topic. The other thing is uh, you need to ask about the impact of that high BMI on the patient health. It could just be physical health, it could be also the mental health. A lot of time we see young females in 30s and 40s coming up with a high BMI like 40, 45, and they are more, I mean, concerned, or they have more kind of a impact on their mental health. I mean, they think that they can't wear the clothes they want to. So we need to explore that part as well, because that's very important, because in that case you might need to need to involve the mental health team, having a psychological support as well, because these people obviously they're in a kind of a complex that why my weight is so much and I can't live a life like someone of the same age. So I think that that's something which can be explored during the scenario. Just to obviously it will not be directly linked, but you need to assess because this is a 10-minute scenario. So obviously you will take just 3-4 minutes maximum to explain the surgery and all these things. But the overall thing I think which is kind of a hidden agenda in this scenario is that you need to look into the impact of the high BMI on the patient physical as well as the mental health, because as I said that generally it take a lot out of people's mental health when you have such a high BMI. So you need to be very empathetic, you need to show empathy, and you need to be mindful when discussing such kind of sensitive issue with the patient, because people generally here they don't, I mean, if you just say that your osteoarthritis is due to your weight, so they will take it as a very rude comment, and at time
Yes.
even if they are in a bad mood, they can even put in a complaint as well that the doctor didn't show any empathy. So whenever, so this is a quite a sensitive topic, it might look very straightforward, but when you are dealing with patient, and I think that this is something which need to be kept in mind. The other thing I think that there is a change in the guidelines as well, the NICE guidelines. I think that initially they mention anyone between 35 to 40 and having diabetes as well. So you can try on these medical management and thing. But I think even with 40, they used to say that the previous guideline. But I think the newer one, which was I think released in 2023, they just mentioned that if someone have a BMI of 40 and above, so in that case you can just straight away consider going for the surgery because of the long term effect of the high BMI on the general health. So I think that's something which have changed in the recent guideline. It wasn't the case in the previous one, but it has changed now. You can just straight away without going for these fancy drugs like Ozempic or something similar. So you can just refer, and obviously 40 previously the 40 BMI in itself wasn't an indication, but now in the recent guideline, I think which was 2023 guideline, if I'm not wrong. So this is something which is considered an indication. So yes, I think that my point is that basically we need to not only the physical health, we need to explore the mental health and how it is affecting the patient mental health if there is any concern shown. So you need to act appropriately. Thank you very much.
Yes. Yeah, thank you, Dr. Hacham. Very nice comment. So let me add a question based on this discussion, um, or this comment. When you can pick up the issue of mental health or psychological issue in two parts in the scenario. Initially, when you ask the patient, how do you do now? Or you can ask him, can I know more about your question to be in the same page? So he can tell you, yes, I feel too much suffering because of my weight, even I feel depressed. Here you can address it immediately. Or as Dr. Hasham said at the end, while discussing the job, the impact on your daily activity, the patient might tell you also this. You can also address it in this time. Be sure that you cover this part in the medical point of view, either in the introduction or at the end. This is one of the tasks in the clinical communication. The impact on the patient, the impact of this condition on the patient. You have to discuss it by this way. Okay, this is the first part. The second part, as a medical option, yes, I'm saying to discuss what written in the scenario as a task. If written medication, you have to discuss the medication. If the surgery, discuss the surgery. But in between, if it was raised by the patient or the surrogate, now you can refer to the assigned team. Okay, if you don't know, if you are sure about it, talk about it. Okay, this is regarding also the medical part of the surge of the management. The last point regarding yes, your weight is the reason. I believe yes, you cannot blame any patient for his condition. Don't use it as a blame. So because of you, or because of your disease, or because of your obesity, you have this or you have that. Don't use this way either to convince a patient or to discuss with the patient. Okay, it's again the welfare. I agree to Just you can say, yes, I see it's quite distress for you. I'm so sorry for your suffering. Don't say because of the obesity. Okay, don't let patient feel regret more than he's feeling. Okay, it's very difficult to blame the patient on his condition. Okay, I think Dr. Gotov didn't mean it, but to be careful next time, not to mention it by this way. Otherwise, yes, good session, informative one, as Dr. was there. Dr. Yes, Gotov, very good and informative comment. Thank you, doctors. Thank you, Dr. Gotov, as well. Anyone want to add anything before ending the session? Any question?
I think if it's an upcoming exam, they might use the same scenario, but to add a twist to it or to change it,
Yeah,
like to convince a patient with with a
yeah,
surgery,
yeah.
or what would be the approach then?
If
Like
they
to use the
want you
same
to
scenario,
convince.
instead of leaving it as open, discuss the surgery, they might want to ask to discuss certain point. Is there any hot trending point in this topic that they might use, like to test the candidates upon?
Yeah, the thing you can use to convince any patient is the future. Okay, the future. Whenever he do the surgery, he will be better or he will be still suffering. Yes, there is complication. You will not change your discussion regarding the advantage or disadvantage, but you will be more talking about the good thing, and you can start with the good things. Okay,
Mhm.
like you will lose the weight easily because you will not do effort. That effort that you did earlier with the exercise, you will be less using effort, and the diet as well. You will eat less, and the complication of the obesity will be very minimal compared to the prior the surgery. Okay, so you will talk it like this. Even if you will do the surgery, you will talk in this way, right? But at the end, you can ask her or ask him, what do you think about our option today? Are you agree to go proceed with it or no? I mean, don't hide any complication or don't say something will not happen. Yeah, there is risk of complication, but let him know the advantage earlier. So you will not suffer, you will feel better. The quality of life will be much better. You can run, you can do hobbies that you would like to do. Okay? So you
Mhm.
can use this weapon to convince him.
Okay.
Clear, Dr. Omar? Yeah.
Yeah, clear,
Yeah,
clear,
I
Dr.
think
Bas.
that, sorry, one thing I just want to add about
Uh-huh.
this, another comment is that, I mean, if you get similar kind of a scenario, so basically you're talking that in one scenario they may be asking the candidate to convince the patient for the surgery. So in that case, I do expect that there will be some reason that why. So we need to explore either it might be given the scenario, there might be some complication like hypertension, diabetes, obstructive sleep apnea. I mean, there has to be a reason, obviously, otherwise they won't put it in the scenario like that. So just need to explore that what exactly is the reason that they wanted to go for that. And then just need to mention that regarding that particular condition that can get worse as well, and also the benefit in terms of what other things which can be potentially prevented by going through the surgery. But again, you need to be honest, you need to go through the same scheme which we have
Yeah.
just discussed. You need to tell points in the favor of the surgery, and you need to tell the complications which are very common, like the metabolic complication, B12 deficiency, folate, iron deficiency, anemia, and all these things. So you need to, I mean, the main theme will change, but the body will remain the same. So, from a surgical point of view, the counseling you will do, it will be the same. So you will not be advocating for that,
Yeah.
and you will not be putting the patient against that. So you need to be neutral. I mean, so
Yeah.
you just need to give an honest opinion and just tell that this could be the benefit and these are the side effects which might be associated with the surgery. So I think, yeah, so yeah, that's my take on that.
Adding to your comment, Dr. Ihtisham, you can say the consultant and the team following you decided in the best interest of your condition to proceed with the surgery. So at least you be in favor with the team that this one is the best interest of your condition. Okay, and now the task will be clear. It's a decision from the consultant. You are not saying this from your mind. You use it as a scenario. the task written in the scenario. The consultant, in the best interest of your condition, they are deciding to do this surgery. However, let me explain to you what are the good things you gain after the surgery, and maybe there is also unwanted effect that might happen also. I will be honestly talking about both of them, then explain them and let him decide at the end. But at least you give him the hint that it's in the best interest of your condition. Okay, adding to the other thing we discussed already. Okay, I think it's a very nice session. I like to be in this way, very informative one, interactive one. Everyone can speak and express what he want to say. And believe me, all the things it will come to your mind in the exam whenever you have this scenario. You will be lucky, any one of you, to have the scenario in the coming couple of days. Most of you having the exam after 2 weeks or couple of days. If the scenario will come to you, believe me, you will get the full mark by remembering the discussion what we have discussed today. Okay. Anyone want to add comment or question before ending the session? Okay. Thank you, Dr. Ahad. Thank you, Dr. Kutuf and Dr. Ayula. It was a good performance, as I said, and also good informative session. Dr. Hasham, Dr. Omar, as usual. Dr. Ihda, everyone commented. See you tomorrow, inshallah, with the long clinical consultation day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Dr.
Alaikum
Khalid.
assalam.
Your
Thank you,
question.
Dr. Bassem.
Okay, thank you.